If you've got bone-on-bone knee pain and you've been diagnosed with a lot of arthritis, these are the exercises for you. So when you've got knee arthritis, it means that you're getting a lot of friction in that joint. And you can actually improve that friction in your joint by loosening up certain muscles around your knee and even in your hip. And then you can also strengthen up certain muscles around your knee and your hip, which is going to take more pressure off that knee joint and help with that pressure and that friction that you're getting at the knee joint. I want you guys first to start off by just getting movement going in your knee. So there's a lot of research behind mobility in joints actually draws in more fluid and can really help with arthritic joints and just stiff joints. So one of the easiest things that you can do just to start with to get your leg warmed up is you're gonna be lying on your back, your good leg's bent up, and then you're just sliding that leg back and forth. You can do this on the floor or on your bed, but you're just trying to get that knee moving and get comfortable with that movement, because you have something called muscle memory throughout that knee. And if you're constantly trying to avoid moving that knee, those muscles and that joint is going to get even more stiff and more painful. I would do this 30 times, and then we're going to progress on to the next exercise. One of the best ways to take pressure off of that arthritic knee is stretching out your quads. So I'm going to show you the best way to do that. You're going to take 2 chairs, get one in front of you so you have something to hold on to. You can use a countertop as well, and you bring this other chair behind you. Now your quadricep muscle is here in the front and it attaches to that kneecap. So if it's really tight, it can compress that area, your knee joint, and make it even more irritated. So we want to loosen that up. So I'm going to put this leg right behind me like this, and I'm going to lean back and hold that for 30 seconds. I should feel a nice little pull here on the front. I shouldn't feel any pain in my knee, and I shouldn't feel any pain in my back. Now if I don't feel much of a stretch with this, then I'm actually going to change it and put my foot on the backrest and lean back into it. Now we'll definitely feel a big stretch here in the front. Now, once again, you shouldn't feel any pain in your knee or in your back, but some people, and actually a lot of people, will cramp up in their hamstrings while they're doing this. Well, guess what you need to do? You just need to fight through it. After doing this stretch for about a week to 2 weeks, you'll notice that those hamstrings will stop cramping up. So 5 times, 30 seconds, do it in whatever position you can tolerate the stretch. Another great way to take pressure off that arthritic knee is stretching out the hips, okay? So if your hips are really tight, it's gonna change how that knee moves. So it's very simple. You sit in a chair like this, take your affected leg up, cross it over, and you're just gonna lean over, okay? You shouldn't feel any pain in your knee. You should feel a nice big pull here in your hip, and you're gonna hold it for 30 seconds. And then you relax and you do that 5 times. If you wanna take it to the next level of stretches, then you can actually lean forward, and now I'm just gonna do a muscle energy technique where I'm trying to push this knee down towards the ground, not with my hands, just with my hip muscles. So I'm gonna lean forward and I'm gonna push down, 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 down towards the floor, and then I relax. And I'm gonna notice that I can actually lean forward a little bit more and not feel as much of a stretch. Now I'm gonna try to pick this knee up towards the ceiling, push up, 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 and relax, and then I'm gonna lean further into that stretch. And I just keep going back and forth until I feel like I hit a wall and I'm not getting much more of a stretch. But if you just want to chill and not do the muscle energy technique and do more of the simple form, you're just going to hold this position, lean forward, get a nice medium grade stretch, do that for 30 seconds, 5 times in a row. And that's going to really help take some pressure off of that hip and ultimately take pressure off that knee. If you've been diagnosed with knee arthritis, chances are you've been having pain for more than a month. You really need to take it to the next level beyond these simple exercises on YouTube and do our online Knee Rehab course. As a physical therapist who's been working with knee patients for really the entirety of my career for the last 12 years, I figured out what works really well and what doesn't. And I walk you through day by day over the course of a month what you need to be doing to stretch out your knee, to strengthen up your knee, and to help prevent any unnecessary surgeries that could take place. So take a look, and you guys let me know if you have any questions in the comments below. You guys have a great day.